Hey everyone, and welcome to This Explainer. I'm so thrilled you're joining us today because, wow, we are going to unpack a truly fascinating topic. Look, we all know that music and sound have this absolutely powerful effect on our minds and bodies, right? But today, we're going to explore a really critical distinction. We're looking at the difference between your everyday music habits, like, just throwing on your favorite calming tracks, and the highly structured world of clinical, evidence-based music therapy. Specifically, we're going to look at who it supports and why having specific goals and proper credentials actually matters a whole lot. So, here's our game plan for today. First up, not just a playlist. Second, defining clinical music therapy. Third, why goals and credentials matter. Fourth, who music therapy supports. And finally, number 5, the role of casual sound. Okay, let's dive into this. I want you to think about your own wellness routines for just a second. When you're feeling super stressed, maybe you open an app and put on some lo-fi beats or rain sounds or just a gentle piano track. And hey, you might even call it your music therapy. But let me ask you a question. Does simply pressing play on a favorite compilation of calming sounds actually qualify as clinical care?
Section 1. Not just a playlist. Debunking the internet myth. The internet has really kind of shaped our vocabulary here, hasn't it? We see the term music therapy used casually all the time across countless videos and articles.
So there are some pretty major misunderstandings we need to clear up right off the bat. Because music therapy, it's heavily misunderstood by the general public. It is not just relaxing music. It is definitely not a Spotify playlist that someone just slapped a medical-sounding name onto. And it's really not the same thing as simply putting some soft piano in the background of your living room. Now, don't get me wrong here. Casual listening is completely valid, and honestly, it's incredibly helpful for our daily lives. But we really need to strip away that internet slang to see that true evidence-based music therapy is, well, it's a whole lot more complex than just hitting play. Which brings us to Section 2, defining clinical music therapy, the science and structure behind the sound. We're officially moving out of the realm of casual, self-guided wellness, and we're stepping right into a legitimate healthcare profession. By definition, evidence-based music therapy is the clinical and evidence-based use of music interventions by a qualified professional. The absolute key phrases there are interventions and qualified professional. So this isn't passive listening. Inside a therapy session, music is doing a highly specific job. These trained professionals use all sorts of interventions. We're talking rhythm, singing, songwriting, improvisation, movement, and music-assisted relaxation. And this brilliantly illustrates the real core truth of the whole matter. Music therapy is not defined by the song, it is defined by the therapeutic process. The magic, the actual clinical value, isn't just trapped inside the audio track itself. It's really in how that audio is utilized as a dynamic tool by someone who is specifically trained to harness it. Section 3, Why Goals and Credentials Matter, the clinical framework. This is a huge focus for us today because the therapeutic process matters so much more than the actual song. Having trained professionals and clear objectives is absolutely essential. I mean, you wouldn't undergo physical therapy without a physical therapist, right? So here's what that clinical process actually looks like in practice. It's a rigorous, structured procedure. First, the credentialed music therapist assesses the person. Second, they identify specific goals. Third, they choose the appropriate music interventions. And fourth, they monitor the patient's responses and adjust the plan in real time. The therapist is just constantly asking, what does this person need? What is safe? What exact goal are we working toward? And how are we going to know if this intervention is actually helping? The really crucial point here is that not every single music experience is inherently therapeutic. Sound is incredibly personal. Without proper professional guidance, loud, triggering, unwanted, or just poorly matched sounds can actually increase a person's distress. Think about it. A song that totally comforts one person might deeply upset somebody else. A rhythm that gets one patient motivated could completely overstimulate another. And music tied to memory, it can be beautiful, sure, but it can also bring up intense grief. A credentialed clinical therapist is trained to watch for those exact responses and safely adjust the intervention on the fly. Let's compare these two realities side by side for a second. Playing rain sounds for your sleep routine is this wonderful, breezy self-care habit. It's great, but true therapy, it's grounded. It's authoritative. It's using music to actively support a physiological function, like breathing, anxiety reduction, or deep emotional processing. And it's all guided by a therapist inside an established medical care plan. They both have immense value, absolutely, but they answer completely different needs. Moving on to Section 4. Who music therapy supports, moving beyond a diagnosis list. When people ask, who is music therapy actually for? It is so tempting to just rattle off a list of medical conditions. But, as we'll see, moving beyond a simple diagnosis list gives us a much, much clearer picture. The absolute best answer to who is this for is a specific goal. Let's think about physical rehabilitation for a moment. For a patient who is recovering from a severe injury or a stroke, simply learning to walk again can be a monumental challenge. In this context, a music therapist uses rhythm. The precise timing of the music literally supports the patient's movement. It provides this auditory cue that actually helps the brain and the body coordinate their steps. It's pretty amazing. Or consider someone who needs to regain communication skills or improve their respiratory function. Here, the intervention totally shifts from rhythm to the voice. Singing directly supports speech and breath goals. It helps patients articulate words or strengthen their lungs, but in a way that feels engaging and natural rather than, clinical and dry. And then, in what has to be one of its most profoundly emotional applications, music therapy offers just incredible support for those in elder and dementia care. When a person is losing their memory and their sense of self, hearing familiar songs from their past can suddenly spark recognition. It supports memory recall, it reinforces their personal identity, and it creates this vital bridge for social connection with loved ones and caregivers, especially when other forms of communication might be fading away. Because it is so incredibly adaptable and totally goal-driven, credentialed therapists utilize music in a really wide array of settings. You'll find music therapy integrated into mental health programs, hospitals and rehabilitation centers, hospice and palliative care, elder and dementia care, schools for developmental support, and broader community health settings. In every single one of these environments, the music is actively being used to regulate arousal, improve attention, help patients cope with pain, and really build up their motivation. All right, Section 5, the role of casual sound, where ASMR and playlists fit in. I promise we haven't forgotten about your favorite sounds. So exactly where do they fit into all of this? Listen, casual listening is still incredibly important. So many of us use music to calm down, to focus, to exercise, to process grief, or just to feel a little less alone. And ASMR belongs right beside this conversation. For people who respond to whispers or tapping or just gentle sounds, ASMR is a fantastic everyday self-care tool. It helps with sleep rituals, and it gives the brain this nice, quiet, predictable pattern to follow. All of that is highly useful, and I want to be clear, your everyday listening habits are completely valid. But here's the ultimate takeaway from our sources today. We really must respect the difference. If the need is a clinical one, well, the support should be clinical too. Absolutely use relaxing sounds and ASMR for your everyday calm and self-care. That's what they're there for. But use music therapy for guided, goal-based medical and psychological care. I want to leave you with this final, kind of provocative thought. We know for a fact that sound and music are incredibly potent tools. They can support arousal regulation, physical movement, and deep emotional processing. So, if sound truly has the power to rewire the brain and the body, shouldn't we treat it with the exact same precision, respect, and goal-driven focus as any other medical intervention? Something to think about. Thank you so much for joining me for this explainer. Keep learning, keep